Well, I don't think there's any question that in Texas, the funds have already been slashed by 2/3 for the state-funded family planning program that happened a year ago. So there are many fewer funds. What has been announced by, again, the state, that they would put in place a law that was passed a number of years ago that really violates long-standing Medicaid policy, which says that women have a right to choose their own providers. And right now, about 50% of the women in the Texas medical program choose Planned Parenthood as a provider. It is illegal to spend any federal dollars on abortion. This has nothing to do with abortion. This is women choosing cervical cancer screenings, breast cancer screenings, well women visits, family planning access at a provider of her choice. So what we have notified Texas is that this does indeed violate federal policy. We will begin a phase-out program of federal dollars that will happen beginning in May, probably take a number of months. We fund right now at the federal level 90% of the program here in Texas. Well, we've certainly seen a debate nationally, but as I say, this long before the debate ensued, the Medicaid law and the family planning uh, Title X program has included a provision saying that there is a choice of providers. So this is not a new battle for the federal government. This has been an underpinning of the law. We informed Texas about that when they passed the law in the first place. They have not chosen to implement that law since 2005. They have recently decided that indeed they are going to implement the law. So again, this dialogue is not new. They know that Medicaid rules and precedent forbids a state from denying a woman the right to choose her own provider in the Medicaid program. I think you're looking at 130,000 women, half of whom have chosen a healthcare provider that would be kicked out of the system. So women would be losing their doctor, their medical home, their choice of providers. Well, we are certainly looking at the options. Again, this is the 1115 waiver. It's a little bit different than the direct family planning Title X money that comes in. But at this point, we think that we want to take time, so hopefully women will have an opportunity to find a new provider. I mean, the worst of all worlds would be to cut off that 90% of federal funding, so leaving women really trying to look for cancer screenings and ways to get their well women visits and ways to have affordable family planning and some other alternative. And we have been working with Texas. We're eager to work with Texas to find a solution to this. But if they indeed go down a path which violates the federal law, we have no choice but to cut off the federal funds.